Hi, my name is Elizabeth, and for the past week, I've been researching all about cultural differences and how they affect our daily lives. As my paper starts, I talk about how we are all different and how we've all grown up culturally diverse. My main points are focused on safe sex practices and how they should be taught in schools, as well as should doctor-assisted suicides be legalized. Making a connection with safe-sex practices, I relate to how my culture views these type of programs, which isn't very supportive considering they're Catholic. They believe in only abstinence, and this relates to conformity orientation, reforming to the degree to which family members express similar or dissimilar attitudes, values, and beliefs, cited Interpersonal Connections, page 243. Relating to sexual programs, I believe they are a great opportunity to prevent STIs and STDs, as well as informing the blooming youth about their bodies. And though some parents do disagree, an example would be with higher levels of education, they were less supportive of teaching specific topics rather than parents with lower levels of education, cited from parents' opinion of sexuality education in a state with mandated abstinence education. For my personal views of sex education programs, I proceed with how everyone's culture affects them every day, even medically, which is when I talk about how some other cultures are controversial because they're known for not practicing modern medicine or going to a regular doctor. Instead, they believe in healing and praying for their health. I relate this to how the medical topic of doctor-assisted suicides should be legalized, further describing that an assisted suicide is when a physician provides the necessary means and or information to facilitate a patient's choice to end his or her life. Cited pros and cons of physician aid in dying. I follow with my cultural view that I believe that they should be legalized and that the public shouldn't hate on it because it's an option for someone who has exalted other options. Following, I opinionate that there should be precautions before the patient is immediately granted permission. One of these precautions is to have a psychologist analyze the patient using kinesis, or the study of communication through body movement, cited interpersonal messages. And then I follow with my conclusion that my life consists of culture. Everything around me is culture, and I'm proud of my culture, which is mostly Southern, and that is who I am.